It's time now for our Wall Street Votes segment, where Bloomberg Daybreak America's host Alex Steele takes us through issues in the presidential race that are of the most interest to Wall Street, business, and the pocketbooks of all Americans. Our first issue is one that comes at or near the top of everyone's list every single year. That is health care. Alex?
Yeah, David, thanks a lot. We're going to go through all of these issues throughout the next couple hours. So starting with health care, the way it could get very dicey is if you have a single payer plan, which means if you get insurance from your employer, you may not be allowed to do that anymore. And this chart shows just how dicey that is for all Americans, because almost 200 million Americans actually get their coverage from their employer. And if that ends, then what are you going to do about it? Now, BNP had a nice poll out that showed that 74% of Democrats, almost twice that of Republicans, actually do favor a Medicare for all. So let's take a look at the different candidates' plans. If you take a look at, say, Warren and, of course, Sanders here, it's Medicare for All Act. The idea, lower prescription drugs and one health care system for everybody. Now, Bloomberg and Biden are going to be looking at more of an Obamacare system, Affordable Health Care Act, expanding Medicare, tackling drug costs, but also sort of increasing and expanding what Obama had started. So you sort of have the progressive, and then you have the more moderate. Now let's talk about why this is so important. We all talk about Medicare and how it's going to bankrupt the system. Well, but this is a really good chart here, and for those of you on radio, it can help show you why. You can take a look at Medicare spending right now in 2022 is supposed to be projected to be about $1 trillion, far outpacing any other public spending for insurance in any capacity. So that's going to put a real strain on the system. Now, if you were going to do something like a Medicare for all, it could be good for things like generics, for example, IT health, and if you expanded it, it would be very bad for things like hospitals, brand drug makers, as well as hospitals like HCA, which is the Hospital Services Company. So does the market care? And the answer is yes. If you talk to a lot of strategists, they say, look, this is already priced in. But this chart kind of tells you maybe not. So the white line here is the healthcare index versus the S&P. So when it goes up, it means healthcare stocks are outperforming. When it goes down, it means they're underperforming. Now, the blue line are the odds of a Sanders or Warren nomination. And you can see the inverse correlation. As the probability that one of them gets elected goes up, you have healthcare stocks going down. You see the reverse happen late last year, where you had healthcare stocks soar as they lagged in the polls, and something very similar happening just now as Sanders really wound up taking off here, and you saw healthcare stocks sort of languish. So it isn't yet necessarily priced in, and we all know the risks, and it's going to be a huge importance to the market, particularly those insurers and the drug makers, David.